All right. So yeah, as Melissa said, please do mute yourselves. Feel free to turn off your cameras if you want, but if you do have a question later when we get to the question and answer time period, just turn your face back on so I can see you as you do that. So I'm going to share my screen here, so you could feel free to turn your cameras off if you want. But it's a pleasure to meet you all. As Melissa said, I am a clinical professor in the College of Nursing and Health Innovation. My background is in nutrition. My bachelor's degree is in nutrition from Northern Arizona University. My master's is in nutrition from Arizona State University. And my doctorate is in hotel, restaurant, and institution management at Iowa State University. And so I've, for many years been an entrepreneur myself. I've kind of had these kind of two worlds that existed. I've been an ASU professor, been at ASU for about 20 years, teaching in the nutrition program and now in the nursing health innovation program. Looks like someone needs to be on mute. Melissa, can you mute everyone? So I've been a nutrition professor and then now in the College of Nursing Health Innovation, but I was always an entrepreneur also. To give you background about a couple of the companies I've worked with, I was the original About.com guide for nutrition. About.com is a startup in New York, has a new name now, but actually it started with the company was called miningco.com, and we searched the internet. This is back before Google, believe it or not. And so I was part of the .com boom. I learned how to HTML code through that process and was real excited about being a part of a startup. Got stock options. It was an exciting ride. All those stocks crashed years later when the .com bubble hit. I've also been a Subway owner, Subway restaurants. My wife and I owned 10 franchises in Arizona. And I've been a part of a couple of tech companies related to healthcare. One was an app that two founders brought me into to help develop, and that's a dietitian app where people would take pictures of their food all day and then get feedback directly from a dietitian. And the company was called My Dietitian. That company now is called Kappa Health, and they're still around. I'm not as attached or involved as I was at one point, but I do have some equity in that company. And then because of my HTML background, I started a website development company, and that was kind of by accident. Sometimes some of the best startups are by accident. Like you just find a need and start meeting it, and then next thing you know, you have a company. That's kind of how that happened. And then finally, and that web company still exists. It's called Dry Wash Media. We have clients all over the country. And then finally, my last startup, which I'm still owned currently, is a dietary supplement. It's called K-Free Daily, and it's just a standard multivitamin with 100% of the RDAs for all the vitamins and minerals that you need for your daily life. And it's a one-a-day vitamin, but it doesn't have one vitamin in it. It's called vitamin K. And so the product is called K-Free Daily, and it was developed by a Mayo Clinic dietitian and her husband, who's a pharmacist. She's a past ASU student. They got the company started and profitable, and then they just wanted to get out of it. So we bought the company, and we've owned that company for about 6 years. We sell it primarily, we sell it 100% online, mostly on Amazon, but also on our own website. So the company is K-Free Daily. So that's all my startup stuff, and still own 2 of those companies. But I was teaching also, and over time had developed this understanding that I don't have to have these 2 worlds separate, that I could actually combine them and help other people with their healthcare related startups. And so my goal at ASU is to, while I'm here, is to help students become innovators and entrepreneurs in the healthcare space. And I'm agnostic to what your degree is. You could be an engineering major, a business major, you could be a management major, you could be a health major. And I hope to get more health majors interested in entrepreneurship. It's not uncommon for business and engineering majors to be interested in entrepreneurship. It's less common for healthcare practitioners. That's why I had the title on here for healthcare practitioners, because I do a lot of the presentations I do are for nurses and dietitians and doctors and My hope is to encourage them to be thinking innovatively, because they're attached to the real problems in healthcare. If you're in a healthcare setting, you know what the problems are, but a lot of them are not entrepreneurially minded. And so my hope is to help them think innovatively and be problem solvers, and or find team members like people who are not in practitioners to co-found ideas. So I'm just going to take you through a few slides here, if I can figure out how to do it. And you may have seen this one before. It's not uncommon anymore, but it was pretty profound when it came out that the world's largest taxi company owns no vehicles. The world's most popular media owner creates no content. The most valuable retailer has no inventory, and the world's largest accommodation provider owns no real estate. And so something that's interesting is happening now. And so the interesting thing for you guys is that you're living in a world of significant disruption, and that includes healthcare. When you look at problems to solve in the world, healthcare is commonly thought of. And the disruptions are vast, and a lot of it's technology driven, not all of it. But I do spend a little bit of time on technology, so I'm going to do a couple slides on this. The National Bureau of Economic Research says that 6 jobs are eliminated for every robot introduced into the workforce. An article from Oxford University said of the 5 jobs that robots will take first, number 5 at the bottom of the slide you can see is medical doctors. Kind of scary, kind of interesting, but true. There are, between artificial intelligence and robotics, we will not soon be replacing doctors or nurses, but we will be an adjuncting their practitioner or their practice through the use of these technologies, which could potentially make things more efficient. It could also make things, could reduce error. That's a big value. We'll be looking for added value. Medical errors is a significant factor in premature death in the United States. I mean, it's not uncommon. When I was a dietitian going through my dietetic rotations at the county hospital, and this is not that long ago. It's not like I'm that old. I've been at Asia for 20 years, but about 20 years ago, before electronic medical records were the norm, I actually watched a patient, 2 patients with the same name, like Paul Johnson, with very common names. And the person that was coming to get the patient for surgery went and grabbed the wrong Paul Johnson, started wheeling him down the hall. And the nurses literally were chasing that person down the hall and went, "Hey, you got the wrong Paul Johnson." And they were going to amputate the guy's leg. Hopefully that would have been caught before surgery. But the point is, medical errors still happen. And so whether that be as bad as mixing up 2 patients, or whether that be as bad as prescribing a drug to someone who's already allergic to that drug, or prescribing 2 drugs that interact with each other, there's a lot of opportunity for technology to enhance and improve the way we deliver healthcare. So if you look at, you do an environmental scan of problems to solve, you might look at health-related problems, 28.5 million people without health insurance. There's an aging population of 10,000 baby boomers retiring every day. In fact, I tell my students, I've been telling my students this for 20 years, that if you want to look for an opportunity to really get into the aging population, I mean, there's a humongous opportunity in aging, whether it's in healthcare or in anything else that relates to aging. There's money there, there's population there, there's need there. Look at the aging population. There's also a shortage of 120,000 doctors and shortage of nurses coming up. 40% of Americans are obese and 1 in 10 have diabetes. So a lot of problems. These are just a few. But health entrepreneurs don't look at them as problems, but opportunities, and the opportunity to find solutions for those. You're all probably very familiar with these. There's many more. This is just a small list of growing trends in technology: wearable devices, real-time monitoring of vitals, virtual and augmented reality, mobile devices, and I'll talk about some of these more in some additional slides: artificial intelligence, healthcare informatics, telemedicine, and radio frequency identification. And then finally, self-driving cars. And we'll talk about each of these in a little bit more detail. We have drones. We're living in a time of the drones. You can get degrees now. There's Lewis University offers a degree in unmanned aircraft systems, a bachelor's of science in drones. We have drones can be used in healthcare to deliver products and to deliver medical supplies. And the top right-hand side is a picture of a drone from a company that actually developed a patent in order to carry people. You could get into a drone and fly around. So ironically living in the world of the Jetsons, and it's right here and it's now. And these technologies are not coming, these technologies are here. These are some pictures I took at the Mayo Clinic in North Phoenix. We're working with Dr. Johnson is the one in the middle in the red. She does work in virtual reality. And on the left-hand side is the director of physical therapy for the Mayo Clinic. And the middle picture by Dr. Johnson is the picture of the director of occupational therapy at the Mayo Clinic. And we're looking at how to incorporate virtual reality in with patients. And there's a million opportunities to do so, again, including physical therapy and including occupational therapy, when there are certain things that could potentially be done at the bedside right now, but the equipment's not there. An example of that is on the far right-hand side, there's a board called the D2 board. And there's one of these that it exists at Mayo Clinic. And it's just if you could see it, it's on the bottom right-hand side. It's just a board of lights. And when they want to use it, they bring a patient, they go get the patient, bring them on a wheelchair, take them up to the hospital, from their hospital room, up to the physical therapy lab. And then they stand them up in front of this board, and then lights go off and they go point at a light, and they point at it, they push a button and push a button and push a button. And you can see that it's using cognitive things. It's also it's enabling them to move their shoulder and their arm. And this entire process, this board right here costs $16,000. We haven't yet, but we could develop the technology and the software to just put that in a virtual reality setting, where you could do the exact same thing with a hand and the goggles on, and you could, for just a few $100s, purchase a virtual reality set and put them all over the hospital. Now you don't have, now instead of having one $16,000 board, you have 20, 30 sets of these, all with the same software loaded onto them. You could, you don't have to bring the patient up to the physical therapy room. They could stay in their hospital bedside. It saves time. It's more efficient. This is just one of many examples that you can do. You can take what we do now in healthcare, which is a lot of times archaic and has been around for a long time, and put a technology spin on it to make it more efficient and potentially better. Couple other products. One of the programs I run is the Tech Accelerator with the Mayo Clinic, and this is a product that came out of there. It's a company it's from Canada, but also the founder, the CEO, also lives here in Phoenix. Product called Hexoskin, and they developed a shirt. It's an internal. It goes underneath your shirt, and it's wearable clothing. It's got monitors throughout it, and it can in real time and live time monitor heart rate, ECGs, breathing rate, activity tracking, and transfer that information in real time to a physician. They already have this technology, this company, in NASA, but now they're trying to break it into the healthcare field. Another company called wearable tech space called Tensor. And it looks like a Fitbit, but it's really a device that measures the tendons in your finger. So if you put your hand like this, I know I can't see you because your cameras aren't on, but put your hands like this and hold these tendons, and then kind of move your hand around and move these fingers around. You can see that all these tendons kind of move around at different rates of speed and different movements at different times. And this can measure that, and it can be used to measure movement after a wrist or elbow injury. Company out of ASU called Circadias. They measure eye movement. It looks like virtual reality. It's not virtual reality. They're literally measuring eye movement to test for things like Alzheimer's disease, Parkinson's, concussions, by looking at how the eyes track and if they're in sync with each other and as they follow dots. Another company out of ASU called Oral Analytics, developed by ASU professors, including an associate dean in the College of Health Solutions and another dean, I believe, in engineering. But it's certainly an expert in artificial intelligence. And this is a device they wear in their ear and listens to you talk. And believe it or not, as you talk, there's things that come out of your speech that could be measured that can determine whether or not you're likely to be at risk for Alzheimer's and Huntington's and Parkinson's. And so they've developed this technology and have built this company called Oral Analytics, which is gaining a lot of success and has raised several $1 million to fund their idea. All cool technologies coming, these last two out of ASU. This is a company that I ran into at a MedTech conference last year in Philadelphia out of Taiwan. And it's literally just a camera you look at, like I'm looking right now at my camera on my screen. And this camera takes thousands of pictures per minute. And as it does that, it looks at the movement of your eyes and can tell you your heart rate and your blood pressure by looking at your eyes. Crazy stuff. And the fact that these technologies exist and have not only are thought of, but have been developed is amazing. Last, a couple more examples. This one is a company out of Arizona also called Advenow, and they use artificial intelligence. They use augmented reality. They use telemedicine, all to deliver a virtual healthcare experience. So some of you may have gone into doctor's offices or health clinics like I have at Walgreens or at CVS, where they have these like small clinics where a nurse practitioner or a physician maybe will just one practitioner will see you. Well, they've put this company Advenow has put their equipment into clinics at Safeways, because Safeways all over the valley in Arizona have these little clinics right beside their pharmacy that were being underutilized or not utilized. And they put the equipment in there so that a patient can go in and you would literally scan the information yourself, like your credit card, your ID card, your medical ID card. You answer a bunch of questions. This is the same company. Answer a bunch of questions on the computer. Do you have a sore throat? How long have you had a sore throat? What other symptoms do you have? Do you have high blood pressure? All these other things. So it asks you a bunch of questions. So then it's starting to use AI to kind of diagnose what your problem is. Then it uses augmented reality so that you can use these devices yourself. Probably many of you have put your arm in a machine that checks your blood pressure at the grocery store. That's an example of a self-diagnostic machine that doesn't require a practitioner to use. They've done that here with a device that goes in your ear and takes a picture in your ear, another device that goes and takes a picture down your throat. You can yourself take your own temperature. So it puts all of those diagnostic procedures in the hands of the patient, and through augmented reality tells you where to put it, even a stethoscope. Ironically, this product and this company is developing some of the most detail-oriented medical records that you've ever seen, because these pictures are saved in the medical record. So are the sounds, the lung sounds and the heart sounds. And so eventually, after you've been through the artificial intelligence diagnostic part, you've taken the picture down your throat, you've taken your temperature, you've taken your blood pressure. Finally, when it gathers all that information, it calls up the doctor, and the doctor in 2 minutes can look at all the information that just came to him or her from the patient and from the AI, and the AI will diagnose the most likely diagnosis, and the doctor, nurse practitioner, physician assistant can agree or disagree. They still make the final call, but all of that process has been done for them, and they can see that patient within 2 minutes and hit the prescribe button, goes to the pharmacy, and it's a done deal. So because of this, one physician or one nurse practitioner can oversee 10 clinics at the same time, and the clinics don't require any medical personnel in them. This is not far-fetched. This is actually live. This company is in Arizona, and they're in Safeway clinics right now. They're also moving to other states as well, and they're gaining a lot of traction. I'll talk to you a little bit about ideas. How do you come up with ideas? And maybe some of you have heard of this, or some of you have not, but this is a study that is out of ASU. It's or at least it didn't originate at ASU, but it certainly is a large program at ASU called Biomimicry. It's fascinating for me, so I like to share it. And that is simply looking at nature and what does nature teach us, and how can we use that for our own solutions. And so because of this, they're making their solutions in our world, in architecture, in engineering, in healthcare, that use technologies that were really designed and developed by nature itself. So you can look at examples of this, like birds, and how they stick to you, and how that and they stick to dogs. And the guy who saw that these birds were sticking to his dog looked at it microscopically and developed Velcro. You can look at it the way we fly airplanes now, and stealth airplanes by the design of birds or wings. They're building buildings now that are designed to collect water more efficiently and sunlight more efficiently. And you're even using it in healthcare. And there's an article You can see it in Science News here, of a company that's developed hospital surfaces that can't carry bacteria because it's mimicked off of the shape of shark skin. And so when you're looking for ideas or solutions to problems, an interesting thing to do is to consider what nature's already taught us. So as much as I'm a believer of technology, I always want to encourage students and thinkers and innovators to also take time away from technology. Go outside, literally look at leaves, look at bugs, look at rocks, and see what you can learn from them. And this isn't a study that I made up. It's a study that's been around for quite a while. We've been mimicking nature for a long time, but the study of biomimicry is an actual degree. You can get it at Arizona State University. And if you're interested in this topic, search that website there called asknature.org, and you can find all kinds of interesting solutions or interesting ideas that come from nature. So the question is, what is innovation? This is a picture I took a couple years ago in my neighborhood. This is innovation at its finest, mimicking what's already been done. We teach innovation. We have, and by the programs I run, I am academically, I run the Masters of Healthcare Innovation program, which is a online master's degree that I don't know how many of you are bachelor's degree, I don't know how many of your master's degrees, but if you're at the bachelor's level and you're interested in a master's degree at some time in the future, this is a completely online ASU online degree. And we teach the process of innovation. And we try to convince people that innovation is an important part of healthcare. And it's a multidisciplinary, interdisciplinary program. It includes doctors, nurses, practitioners, pharmacists, non-practitioners, but we can teach it, and we do. Some of the spaces that we run include the Health Entrepreneur Accelerator Lab. That's my lab. Primarily exists downtown. We're going to a new building called the Wexford Building. If any of you heard of it, ASU owns like three floors on this brand new building that's not even open yet. It opens in January. Called the Wexford Building. It's an 8-story building at the Phoenix Biomedical Campus. It'll have labs in there. It'll have innovation spaces in there. If any of you have been to Skysong and been familiar with the 1951 space where you can just go and co-work, we'll have a space like that at the Wexford Building, and there'll be opportunities to meet people like investors and other co-inventors and those types of things. So that's the HEAL Lab. All of our meetings this semester have been virtual. So if you're interested, type in HEAL Lab, Health Entrepreneur Accelerator Lab, ASU, go to the website, email Taylor or get on our email list, and you can join one of our virtual workshop series, just like the one you're in now, but it's specifically related to healthcare. Just a couple other ideas that have come out of ASU. Some of you may know this person, Jared. He's a professor in the engineering college who was once a graduate student and developed SafeShip, which is a product to push water and doubles the water per trip and reduces travel time by 80% while all at the same time filtering water. And that's a product, obviously, it has no techno or electrical technology, and it's still technology, but you don't have to always have electronics or apps to have a great idea. These two students, also engineering students from the female engineering students, in 2011, won the Entrepreneur Magazine's College Entrepreneur of the Year award for recognizing that a good idea would be to take a shipping container, which is what they're standing on in the far top right-hand corner, and retrofit the inside of it to be a medical clinic. What's cool about this is you could literally drop it anywhere in the world. I mean, you could put it on a ship, you could drop it out of an airplane, but you can retrofit the inside of it as a medical clinic. And they did, and there it is. And there's the first one. It's called the G3 box, and it's in Kenya. Neolite, another medical related product that came out of ASU. It's simply phytotherapy used to help infants that are born with jaundice, get rid of the jaundice through light therapy, and can be portable and used in the homes. Other ideas that come out of students, avatar-based wellness apps, home meal delivery service for diabetics, kind of like Blue Apron, but for diabetics. Medical facilities to detox infants born with opioid addiction. That clinic is opening this month, I believe, in Phoenix. This is another student of mine on the far left. Her name is Ramona, and she's now a professor in our program, but she developed a product called New Trails Navigators, which would train peer coaches that are from people from previously incarcerated in prison to be healthcare navigators, using AI as a platform to find the right people and train them and place them in hospitals. And another student came up with an app called Gnosis Health, which is an avatar of your body, and it changes based on your health behavior. So this is Wilman Vergara, and he is a past master of healthcare innovation program student. Just a couple more slides and I'll stop and pause and take questions and comments and hear from you. This is a picture of the inside of the HEAL Lab. We do food entrepreneurship as well. We teach even community members. This particular program is geared toward women, people of color, people from lower household incomes who aren't even ASU students. You could be an ASU student, but most of the participants have not been. We've been doing it for 4 years, and we've accelerated over 100 businesses in this program, mostly food trucks and catering businesses. We put on conferences every year. We've done one on artificial intelligence. We've done one on digital health. This year's conference is on loneliness and mindfulness and the role of artificial intelligence in that. And it's December 4th of this year. It's going to be completely virtual. Love to have you at that conference. There'll be lots of marketing around it, but get on our HEAL Lab listserv and you'll see that. We also do a Health Innovation Expo where we award prizes to students who come up with really good ideas related to health solutions to real world problems. And then finally, I run the Tech Accelerator, which is where some of these programs came out of. And I say I run, I'm part of a team, but I am the managing partner for the ASU side. We have a managing partner on the Mayo Clinic side as well. And we bring in companies who have raised $500,000 or more or are in recurring revenue, and we accelerate their business. So these are companies who have a little bit of traction, not early stage, maybe later stage, but still startup stage, that really are interested in an immersive experience to get their product into the healthcare system. So I'll give you some parting thoughts, and then I would love to hear your ideas. So I'm gonna go through just a couple more slides on thinking entrepreneurially. First, obviously, you have to identify a problem. Like I said earlier, healthcare people have no problem identifying problems. There's lots of problems in the world of healthcare to solve, and there's no shortage of them, actually. The hardest part is to find an actual problem for people who are not practitioners. So if you are not in the healthcare system and you're trying to solve a healthcare problem, I strongly encourage you to go talk to people that are in healthcare problems, that are in healthcare. You've got to identify the problem. Super important. Okay, but there are problems. The second is to develop a solution, test that idea. You've probably heard of the lean business methodology. That's what we teach. We commonly teach that. We do a business model like every other program, in healthcare. We do the same thing. And then we launch it, and then we test it, and then we potentially change it, and we iterate it. So those are all part of the problem. They're all part of the process. I encourage you to ask a lot of questions. How many people, put it in chat, how many people could tell me what this is? What's this a picture of? Put it in chat. There you go. Camera. What kind of camera? Polaroid camera. Very good. What's interesting about the Polaroid camera was developed by Dr. Edwin Land, and he was a well-known expert in cameras, and he helped develop the technology of cameras that went into spy planes, and U-2 spy planes. He's dead. He's no longer here. But when he developed this, by the way, Steve Jobs considered Edwin Land his hero. So a significant innovator who lived 50s, 60s, 70s was inventing amazing technology. The technology of a Polaroid camera is pretty incredible. It takes the picture, but for those of you who don't know, we didn't always have digital cameras where we could take a picture and see it immediately. It used to be a process. In fact, not too long ago, it was a process where you put film in a camera, take a picture, you send it, it imprints the picture in a negative format. You send it to a lab, and then a week or two later, you go back and pick up the pictures. That's how it was even when I got married 25 years ago. But this Polaroid camera was interesting because it did that, and it actually developed the film, and actually printed the picture immediately. And that was incredible. It was incredible back then. It's incredible today. And how it was developed is the interesting part of the story. So Dr. Edwin Land was on a vacation with his family, and his 3-year-old daughter, he took a picture of, and she asked him, "Daddy, how come I can't see the picture now?" And so he described to her, his 3-year-old daughter, the process of how pictures are developed and why you can't see the picture now. And then he went on a walk, and in 20 minutes invented the Polaroid camera in his head. So you can look up that story. I may have got her age wrong. I may have got the 20 minutes wrong, but that's literally what happened. Is his daughter asked a question. He explained to her why it can't work, and then he developed the solution in his head and then invented the Polaroid camera. The point of that whole story is to ask questions, ask lots of questions. Too often, people who are innovative thinkers do have questions, and they're shut down really quickly and told that won't work, this won't work, this is why it won't work. But ask questions, and because all innovators are good question askers, and so take time to do that. The other thing is to get out. And so I mentioned this earlier, but I say get outside. And Bill Gates even does this himself. He takes 2 one-week think weeks per year. Get away from the internet, get away from cell phones, go outside, go to a secluded location. I know you may not be able to do this for 2 1-weeks a year, but you could do it every day. You could go outside. I'm doing my talk outside right now. I could have stayed in the house, but I'm outside. You need to spend time outside. First of all, different parts of your brain are activated when you're not staring at a screen. So by looking around, I can't tell you how many times I walk through campus and see students staring at their phones. My own kids do this quite often. It drives me crazy. So you're not activating other parts of your brain when you're just staring at a screen. It's a very passive exercise. Second of all, you will have the opportunity to witness some of those things that I talked about earlier with biomimicry and see what nature is already telling you and telling us. Third of all, and this is a good part, is your health improves. You are actually, the research is very clear on this. You go outside and exercise, whether it's walking or running, your blood pressure almost drops immediately. And you do not get the same effect from a treadmill. You do get benefits from a treadmill, but not the same blood pressure dropping effect that you do from being outside. The research is very clear on this. Spend some time outside. We are, as humans, we're animals, we need to be outside. It also increases your creativity. So this is a study that came out of Utah, the University of Utah, and they took 60 men and women who were going on a 4-day nature hike. And they said, okay, we're going to give half the group, 50% of the group, a creativity test on day 1. They took everybody's phones away. They gave half the group a creativity test on day 1. They gave the other half of the group a creativity test on day 4 after they'd been away from their phones for 4 days. Which group do you think was more creative? I'm sure you know the answer. It's the second group. And it's the group that had been away from their phones and away from the technology for 4 days. Creativity increased by 50%. So take time away. Get off your phone, get off of the computer, and get out into nature. Go walk, go ask questions, go talk to people. You're going to find that you're a better thinker through that process. Find your thinking spot. Wherever your thinking spot is, go there. And for me, it's swimming. I like to think when I'm swimming. I can swim for laps and laps and laps and solve all the world's problems. The problem is there's nowhere to write down my ideas. So when you're swimming, but look for an opportunity to carry a notebook if you can. Carry a notebook and write down your ideas. Sometimes some people think better in the shower. Some people think better when they're sleeping, they wake up, have a notebook right next to you so you can write it down. Look at things, deja vu, the opposite of that would be vujade. I didn't make that up. It's out of a book called The Originals by Adam Grant. And this is just, instead of like seeing things and like thinking you've already been there, look at things that you see every day and try to look at it differently. That's vujade. Practice remote association tests. This comes right out of creativity tests. Manners, round, and tennis. I don't know if you know what, and did anyone put in chat what those 3 words have in common? Manners, round, and tennis. Let's see if anybody comes up with the answer. No one? The answer is table. Table manners, round table, and table tennis. That the ability to put things together who don't normally go together shows a sign of creativity and innovation and divergent thinking. So when you look at the engineer students who they didn't invent a healthcare, they didn't invent a hospital setting, they didn't invent a healthcare clinic, they didn't invent the shipping container. They invented neither one of those 2 things, but they put them together, things that didn't seem to go together, and made a solution out of them. Look for opportunities to do that. I won't take you through this because it takes a little bit more time, but when you ask people to come up with how many uses they can come up with a paperclip, and you give them time to do that, what they find is that kids can think of a lot more than adults can. So 5-year-olds come up with 200 uses, 10-year-olds can only come up with 100, and it goes down after time. And that just shows you that your creative thinking kind of goes down over time because you're starting to put limitations on your thinking. So those of you who are still college students, practice and go out and try things and make lots of mistakes and embrace that and ask lots of questions, because this is your time. This is when you are at your most creative time. On the far left is a small screwdriver. And that's the kind of screwdriver you use to tighten the glasses, the little screw here and here. Thing is, you can never find these when you need them. And so I'm going to teach you how to make one. Take a paper clip, straighten it out, take the end of it, hit the end of it with a rock outside on the road, and you'll flatten the end of the paper clip and make a screwdriver out of it. Okay, so last 2 slides here. Solution, lean startup methodology. I'm sure you've probably already learned about this or heard about it if you're interested in these topics. But solutions only succeed when they meet a need. And so you have to think of being of the customer. You have to think of who are the users. You have to test the idea. You have to talk to people. Ask people if it's a good idea. Don't make assumptions. I've been a part of companies that have spent over $100,000 on an idea that the founders thought were a really good idea and nobody wanted to buy. So make sure that you're talking to the customer before you develop the product, and as you're developing the product, and after you've developed the product. This is the whole idea of this is human-centered design. You know, what are your customers hearing and saying and thinking? What are their fears? And what are their pains? And then finally, you can determine what their gain is. You have to add value. And if you're not adding value, if you're not making their lives easier or faster or less costly or more efficient, they're not going to purchase it. I mean, it's really quite simple. And nor would you. You wouldn't adopt a new product if it didn't make your life better. So you can't expect other people to do the same. So the only way to know that is to know the person in the middle. So make sure you're thinking from that perspective. I'm going to pause, and I'd love to see your faces again. I'm going to take some time. The last couple of slides are just some more ideas of thinking entrepreneurially. So if you're interested in showing your face, I'd love to see it. I've talked for almost 35 minutes. I could keep talking. I could talk all day if you wanted me to. But I'd love to see if you guys have any thoughts or questions about any of the topics I've already talked about, or ideas that you'd like to share. I know that some people do that or have already started doing that. But let me hear from you. So what are your ideas on health, innovation, entrepreneurship, or any of those topics that we've already considered, or questions?
Hi, I have a quick question. Hi. So you described that there's like a lot of like low hanging fruit in the healthcare field when it comes to innovation. And obviously there's not like a lack of money, because we all know that the healthcare field has a lot of money. So why do you think that the medical field is like behind when it comes to innovation? You described it as sometimes like archaic. So
yeah, well, I mean, there's several things that factor into that. I mean, if you develop a new technology like an app for social media, people could just do it and trust it and use it and no problem. If you're developing an app that affects someone's health or is supposed to improve someone's health, first of all, there's potentially regulatory issues that you have. So you may have, depending on what your product is or how advanced it is, it may need to go through FDA approval, which could take years in some cases. And while you're doing that, 2 or 3 other companies are also trying to solve that same problem. And so that could be a potential problem. You finally come up with your product, and someone else has already come up with a different solution related to that. So regulations can be an issue. Adoption can be also an issue. I think a lot of, if you ask doctors and nurses who are in hospital settings, how many times a day or a week that they are introduced to some new technology that's supposed to make their lives better, it's exhaustive because everyone's coming up with these things to make their lives better. And with the adoption of technology in hospital settings, like electronic medical records and everything else that they have to, the AI components, the IVs you have to put into you. There's so many different things that it's exhausting just to keep up with it, to be quite honest with you, especially in a hospital setting. So for those reasons alone, you need to really have value. I mean, you can't even ask a doctor to even listen to you with a solution that you have, unless you're promising and you can deliver on this to make their lives faster, easier, better. It was pretty telling to me when I went into the emergency room at the U of A Medical Center in Tucson a couple of years ago. And the two doctors who came into the room after waiting for quite a long time, both rolled in with computers. They had a computer cart and they rolled in and they're typing the whole time. And they didn't even look at me. I mean, they were asking questions and typing. Some of you have been to doctor's offices where they're typing instead of listening. And so this adoption of technology in healthcare, it's still relatively new. I mean, it's been coming and evolving. But at the same time, there's so many things out there to use that it's been kind of, and frankly, there's practitioners who've been in the business for 20, 30, 40, 50 years who sometimes aren't willing to learn new things. I actually had a procedure at Mayo Clinic right before the coronavirus, literally February, March, right before everything shut down. And the doctor who I used, the surgeon I used, did not use anything electric for scheduling. They had a book, and the person comes in with a book and opens it up. And I said, "You're using a book to schedule?" She's like, "Yep, he's the only doctor at Mayo Clinic that still uses a book." And she pulled it out and she opens the book, and he's a great surgeon. He did a great job with me, but he'd been around for that long that he doesn't use technology. He's like, "I'm not using it." And so there's that. There's a lack of desire to do it. There's the lack of time to learn it. Then there's the regulation stuff. When I mentioned Hexoskin earlier with that shirt that you wear underneath, and I told you they're already in NASA, that was much easier for them to break into outer space than in hospital settings in the United States. And that's how crazy it is. But it's a difficult field. No one will question that. I mean, no one will disagree with that. That's why we have things like the HEAL Lab and the Tech Accelerator to help people with startups to find that path, because it's a difficult path. It really is. Especially, I would say, also in the United States, because our regulations are a little bit higher. I've been to some of these med tech conferences, and I've seen products that were amazing that aren't in the United States. They're in Australia, they're in England, they're in Europe, and I'm like, why don't we have that? Why aren't you in the United States? Because the FDA process is too long. And so they're just doing them in other places. So our healthcare is great. I'm not downing the United States healthcare system, but I could tell you that some of the best innovations aren't happening here because it's a hard tree to climb. Did that kind of answer your question?
No, that fully answered my question. Yeah. So the whole FDA is almost like an opportunity too, but that's like a whole policy issue thing, You're
talking about the federal government. Good luck with that. So
I know.
The good news is there is a path to get there, but it could be, in some cases, depending on what the product is, it could be years and very costly, which is why a lot of companies have to eventually raise millions of dollars just to get a product out, or they have to get sold to a bigger company for it to happen. But you are absolutely right, Brooke, that there's a lot of opportunity and there's a lot of money. So if you have the right idea, this is a great place to go. And, and there's other things you could do in healthcare related ideas like nutrition and fitness that don't require the FDA approval. You can get out of it. You could do health related entrepreneurship and not get into mess. But in healthcare, in hospital settings, for sure, it's messy and expensive.
Hey, Rick, it's John Vallata. We're going to be moving over to Mirabella sometime if they ever finish the building up. So we have a little clinic in there, and what the Mirabella folks are trying to do is figure out, who's going to come in there and whatever. So just as a plug, you could put one of your high-tech telemedicine things in there and use it as a lab, and we could be your lab rats. Just
great idea.
The one thing that I was going to mention to Brooke is I hike a lot, and a couple of years ago I was climbing up to the top of Superstition Mountain. I don't know if you guys are familiar with that. It's probably one of the high. It's a tough climb. It was warm that day. I've hiked for years and years and years. So climbing up. I'm drinking the water, doing all the things you're supposed to do, and I'm near the top, and then I faint, and so like, wait a minute, what's going on here? So I borrowed some Gatorade from one of the ladies I was hiking with, drank the thing down. Okay, no problem, recovered. So then I went to my doctor, and I'm like 74 years old. So I went to my doctor and told him what happened. He said, I got to take a very, very small blood pressure pill, but there's a little diuretic in it. So he says, okay, the problem is you got too much, you didn't have enough salt in the blood, and your blood pressure fell out the floor, and you fainted. Okay, so that's the problem. Then was the fact that my blood pressure fell. My Fitbit, my pulse rate was fine. My blood pressure fell, and that's what caused me to faint. So one of the things that I've been looking and hoping that somebody would come up with a sort of a Fitbit device that could give you real-time blood pressure. That's probably better than pulse rate if you're a heavy exerciser. So there is like Brooks says, there's a tremendous amount of opportunity.
Mm-hmm.
I have no idea how you would actually measure blood pressure without a cuff or something, but Rick said there's some way to do it by looking at your eye. So there's an opportunity for somebody to come up with. So there's all kinds of stuff like that, that you find. And of course, you'd have to interview a number of people to figure out what the problem is, in certain. Now, that's only for people who do a lot of exercise and want to try to eliminate that problem. But anyway, just a thought. There is a lot of opportunity, but I do think that the heavy amount of regulation in the United States compared to other companies kind of holds you back if you're trying to get into practice of medicine. Just my thoughts.
Yeah, good thoughts. And I'll say that, a lot of these ideas and these things that are coming out are things I would have told students, no, that would never work. If a student came to my lab 2 years ago and said, I want to take pictures of the eye and measure blood pressure, I would have said, no way, that ain't gonna happen. Point is, and now some company in Taiwan developed it. So point is, even and I've been around this area for quite a while, I still like put limitations on things. So just like think really, really outside the box. And yeah, you might find out it doesn't work, but you also might find out that you could develop, a significant tool that could be really useful and save millions of dollars in healthcare if you're just willing to do a little bit of work. One article I did, one slide I sometimes show, but I didn't this time, is a high school student who, not even a college student, a high school student who developed a diagnostic tool to diagnose prostate cancer. And he did it on the internet. Like he searched Google, found all what the problem was, and then figured out all he needed to do was and this was, he did a TED Talk. You can go find this kid, 17 years old, and just using the power of the internet, developed this prostate cancer screening tool. Amazing, and nobody wanted to listen to him. He sent letters to all these professors and said, I'd like to do some research in your lab to validate my product, and then no one wanted to listen to him. And finally, one professor listened to him. That's a 17-year-old using Google and whatever else he used to finally get his product. But there are opportunities. You just got to go find them and create them, and don't listen to people who tell you it's not going to work. I mean, you should listen to people, but don't necessarily take that advice, take that in. And then if you still think you could, go try it. I would have never thought you could look at the eyes and tell someone what their blood pressure is. It's incredible. Go ahead.
Just another quick comment. Instead of a Fitbit that measures blood pressure, maybe there's something you put on your Fitbit. I have no idea what it would be. It's a surrogate for blood pressure.
Sure. I think there is, John. I'm not 100% sure, but I believe there are some portable devices that go on your wrist for blood pressure checking.
I've been looking, but if there are, there may be more diagnostic. I'm talking about something you could, you're not going to pay several $100s because you've got a problem, but there are surrogates too. So I think you're absolutely right. You need to kind of expand your horizon. The problem was my blood pressure fell and I fainted. You don't want to do that. If you're like a survivalist, for example, and you're out in the middle of nowhere, and so maybe it's not blood pressure, maybe it's something else, and some of you young folks can figure that out. So I don't think it
could even be heart rate. Obviously your heart rate's going to be increasing when you're hiking up a mountain, but maybe the irregularities of the heart rate could diagnose something else. There's an interesting story from a few years ago where a woman found out she was pregnant from her Fitbit. And how it worked is her resting heart rate while she was sleeping was going up. And so she put it on a discussion board on the internet and said, does anybody know why my resting heart rate keeps going up? I don't understand why. And a nurse responded and said, have you considered the fact that you might be pregnant? And she said, maybe I don't know. And so she went to the doctor and found out, yeah, she was in fact pregnant and her resting heart rate was going up. So you never know what an existing tool could teach you, like a Fitbit, maybe like your Apple Watch or your Apple phone, and so some of the data that it's collecting. That's what's really cool about artificial intelligence. It can look for trends that we never even thought of before. You put enough data in a computer and ask it to run some trends, it might find that maybe cancer rates are increased by people who spend time under fluorescent lights or something like that. I mean, it could be anything that we didn't think of as a correlation. And so you could do the same thing in some type of healthcare solution. Maybe there's something we can already determine with a certain heart rate and a certain respiratory rate that could also diagnose some other thing like blood pressure increases. And those tools do exist, even if it may not be measuring blood pressure, but it's measuring those other things. So I appreciate those comments. I think you're right on, John. And by the way, what John's talking about, blood pressure, it's high blood pressure or hypertension is considered the silent killer because people don't know they have it. When you're having heart pain or breathing issues, you know it. High blood pressure, you often don't know you have it. And so it's the leading cause of premature death and kidney failure, high blood pressure. And so if you can help people predict that they have people don't typically find out they have high blood pressure till they go to a doctor, and then they get, or a paramedic or something like that. That's why it's cool if they have these machines in grocery stores that you can just put your arm in. I do it all the time. I just want to know. But most people don't know if they have high blood pressure. So any kind of device that could do it in real time, like you're talking about, would be very helpful. We only have a couple more minutes, but if you have any other questions, anybody else have a question who hasn't asked one that maybe is just itching to, but they're afraid to take their phone off of mute or camera off of mute? Well, we'll do a final plug for some of the activities I'm involved in. Like I said, on December 4th, we have a big conference on human connection, loneliness, mindfulness, and the role of technology in that. We also have the Heal Lab weekly series I'd love for any of you to be involved in. And maybe some of you have been to some of them. It's every Thursday. So you can go to the Heal Lab website and sign up for one of those. When we open the Wexford building in January, I'd love to have you come by and stop by. Hopefully we'll be there and in person, presuming everything goes well, and we'll probably still be in masks, but we'll be there. We're also building, and I didn't mention this before, but the ASU is opening at the end of this month, a Health Futures Center, which is on the Mayo Clinic campus in North Phoenix. ASU owns like 14 acres there, and we just finished our 3-story building in that space where we do the Tech Accelerator. So there will be opportunities sometime in the future for health entrepreneurship activities there as well. But I appreciate you coming today. I'll turn it back over to Melissa to close up, but thanks for your time today, and I look forward to maybe seeing some of you in some of those other activities.
Awesome. Thank you, Rick. Thank you everyone so much for coming today. Like our previous Make It Happen sessions, we'll be uploading this recording. Sorry, my Zoom is a little close today, to our website. And then we hope to see everyone for our next session taking place next Friday. So thank you everyone again, and I'll hang out here for just a couple minutes until the end in case anyone has any other final questions or thoughts, but hope everyone has a great weekend.
Have a good weekend. Bye-bye.